it's Dr. Karen here, and I thought I would take a little time to share with you a couple of LifeWave knee patching protocols and also some nifty tools that I am using myself and recommend to my clients as well to help them with their overall wellness and, kind of restructuring their bodies a little bit so they don't have recurrent knee pain. So I'm going to get started with the patches. Now these phototherapy patches are really handy for getting rid of the symptom of pain, usually within just a few minutes. Much faster than pills, much safer than needles, and actually faster than acupuncture itself, which is why I used to call them acupuncture patches. So the ones we're going to demonstrate today is we're going to go through the simple protocol, which is in the brochure for the LifeWave patches for Icewave, which is the ones for pain, and then I'm going to go through a couple of more advanced protocols for knee pain, including the triangle protocol for knee pain, and I'm going to be demonstrating how you could use the X39 stem cell enhancing patches for this symptom, and then the AEON anti-inflammatory patches. I got to tell you honestly, I used to take anti-inflammatory medications way back when, way before I knew about these patches. I took the stuff like candy, okay, like candy. I was in the physical therapist office like every other week. They're like, oh, she's back, and I didn't think much of it, ibuprofen, naproxen. Naproxen was my favorite. And I would just take it like candy, not knowing that it could destroy my gut and my immune system through the gut. And my gut became holy, meaning full of holes. And with the other medications that I was taking at the time, like asthma medication, birth control pills, I really got myself into a lot of trouble and ended up with autoimmune syndrome, fibromyalgia, and chronic fatigue syndrome. So I highly recommend these patches. If you have stress or inflammation, these are much, much safer than taking anti-inflammatory drugs, really. It's not covered by insurance, but I got to tell you, the amount of money that you're going to spend in trying to repair your body from all those medications and all the lost time at the doctor's office and off work and everything, it's just not worth it, So that's why I'm a big advocate of using natural therapies. Okay, so let's start with our first protocol. So this is going to be the Icewave protocol that's in the brochure. It's called the clock method, and I'll show you how you can do the clock method for knee pain. So first, what you want to do is make sure that you have both the white and the tan patches. Some people get the package and they don't realize that there's a divider in here, and on the back is one color and then the front is another color. So make sure you have two patches because the Icewave needs to move energy from one pole to the other. This is the yin and yang, Actually, this is the yin, this is the yang. So there's energy movement between the patches, and that's why we need two for the Icewave. And this is our traditional one, the patches that we use for pain. So what we're going to do is we're going to take some tape, okay? And we are going to make a little circle with the tape, so a curl of tape, and I'm going to put them on the back of one of the patches. Now, here's a trick. The patches have like a divider in here where you can take the sticker backings off. You do not have to take the sticker backings off in order to do the testing to see what placement is best for you. So I'm just going to put the tape on one side of the sticker backing because it's notoriously difficult to get this tape off after you've been using it for a while. So I'm going to, let's see, there we go. I'm going to put that on the back of the tan. Okay. All right. So I'm going to set up on a chair back here so you can see my knee. You'll still be able to hear me, hopefully. All right. So got my little bench here. Okay. So hopefully you can see that. I'll go ahead and patch the left knee, and we're just, what you're going to do, number one, is figure out how bad the pain is. So especially if you're patching another person, you want to know out of 10 how bad the pain is. So, if there's no pain when you're not moving it, then go ahead and move it, or stand or whatever you need to do to figure out how bad the pain is out of 10. What makes it worse, right? Maybe straightening it, whatever. So you have how much pain it is out of 10 when you are not moving it, and then when you are moving it. Okay, so you write that down somewhere or memorize it. Okay, so now what you want to do is, get this, drink some water because the patches don't work as well if you don't have energy flowing through your body. So let's drink some water. Now I just drank a big smoothie, so I don't think I can drink anymore, but 16 ounces is ideal. Okay. Now, what we're gonna do is you figured out how much, how bad the pain is out of 10, moving and not moving. You've hydrated. So the next thing you want to do for the traditional patch protocol is you're going to figure out where it hurts the most. Okay, where it hurts the most. And you're going to go and put it, I'm going to go ahead and put it here. Okay. The tan patch is going to go on the worst part of the pain, wherever you're feeling it. Okay. Now you don't have to get all fancy and go, oh, I've got, bone on bone, or I got a meniscus. It doesn't matter. Doesn't matter what your diagnosis is. You use the protocol. I can't tell you how many times as an acupuncturist and MD, I tried to figure it out and tried to be smart, putting these patches where I think it should go. And you know what? The protocol worked better. So, okay, so you put your tan on here. Now, for the protocol, it's called the clock protocol. You're going to put the white one a couple of inches above it. So I'm going to go ahead, I'll put it here. Okay, put it here. So that's going to be my 12 o'clock. So directly above it. So I'm going to wait 10 to 15 seconds, not 20 minutes, 10 to 15 seconds, figure out if that's better or worse, and then write that down, okay? So in the clock protocol, what you do next is you take the white one. Now you go to 3 o'clock. So we'll go over here, and it doesn't matter which side, anyway, 3 o'clock. Again, wait 10 to 15 seconds, okay? And then you're gonna move your knee, do whatever it is that was causing the pain before, and see if it feels any different. And our goal is at least 50% decrease in pain. So if you are at an 8, we want a 4 or less, right? So 10 to 15 seconds. Okay, so guess what? Move to 6 o'clock. Okay, so I'm gonna move to down here, all right? And again, wait 10 to 15 seconds if you'd like. You can sing the Jeopardy song. This is what we used to do in our live training, sing the Jeopardy song. The jingle. And then go ahead and move and see if the pain's better, okay? And write that down. Okay, and then you're gonna go 9 o'clock, so we'll just put it, where's 9 o'clock? There we go, okay. So it could be here, it doesn't really matter. You can see it better on the video if I put it here. So about 1 to 3 inches away. Now here's a tip. For some people, especially that 6 o'clock or 12 o'clock, the further you put it away, sometimes the better results you get. So you can experiment. Usually it's 1 to 3 inches, but you could do like 6 inches or 9 inches away, okay? So again, after 10 to 15 seconds, move around and see if that, works. Now, for most of the time, this works great. Like 80% of the time, 80 to 85% of the time, decrease in pain at least 50%. And I know I've talked a lot, but literally you're doing just 10 to 15 seconds per placement, right? So the other thing you can do, okay, so that's your basic clock protocol. Now, if any time during this you feel worse, here's a tip, okay? All you gotta do is switch the colors. So you would take your white over the pain, and then your tan, wherever you got the worst, if you got worse pain. It's not dangerous, but it just gives you information that the energy wants to go in the opposite direction. Okay, and you're gonna do this, right? Okay, so that is our basic clock protocol. All right, so number 1. So now I'm gonna share with you a different protocol. So this protocol is, we use what's called in Chinese medicine, the eyes of the knee. And you'll know it when you see it, why it's called that. The eyes of the knee. We're also going to use Icewave here, okay? And now we're going to add on an AEON or an X39. So we'll just go ahead and we'll say you do have damage in your knee and I don't need to know the diagnosis, okay? Say you have damage in your knee, you'd be like, wow, I really want to, repair that damage with stem cells. So then you would take your X39, and they're labeled on the back, by the way. And again, in this case, I'm just going to use tape because I want to show you other protocols, so I don't want them stuck to my skin. So that's your X39. All right, so now I'm going to go ahead and, again, get some more tape for my Icewave because the stickiness has rubbed off. Okay, so we're going to use 3 patches for this triangle protocol, okay? So what we're gonna do is I'm gonna go ahead and tilt this down so you can see my knee again. Okay, so the eyes of the knee are underneath, this is my kneecap right here, okay? It's underneath the kneecap and it's on either side of this tendon. This is called the patellar tendon. The patellar tendon attaches from the bottom of the kneecap onto the tibia bone. And on the tibia bone, there's a little bump here, okay? That's called the tibial tubercle. And so right underneath, okay, and you can see I actually did a CrossFit workout today, so you can actually, I don't know if you can see it, but it's a little poofy here. Okay, so actually this is my joint line, but don't worry about that. So you're gonna go on either side of the bump, and then you'll feel a ridge, and right above the ridge, you'll actually feel like there's a hole. Here's your tendon, and then there's a hole on each side. Guess what? This is the eyes of the knee, okay? Now, we're gonna use Icewave on the eyes of the knee. Now you might say to me, well, which one do I use? Do I right or left, or on the left or right? You know what? In this case, doesn't matter. So start with one. So we're gonna go ahead and start with the tan on this eye. We're gonna go white on this eye. And for the triangle protocol, you're gonna take your X39, okay? And there's a couple different options. One of the options is right above the kneecap. So I think that point is called Hey Ding. Hey Ding, how you doing? Okay, so right above the kneecap, okay? So what happens is you have this triangle of energy kind of focused in, you know, on this joint, okay? Now, if you do this, remember to drink water. If you do this, okay, again, move around, see if, 10 to 15 seconds, see if it's better. Again, if it's worse or you're not really sure, you could try an experiment. These are very safe to experiment with. So we're gonna go ahead and use the eyes of the knee, like that, okay? And then you go ahead and move around, see if it's better. All right, one of the things you can do, now the eyes of the knee, especially for actual joint inflammation and problems, this is really, really good. Now, when I have knee issues, oftentimes it has to do with the misalignment of my bony structure. I'm still working on that. We're gonna have a radio show in a couple of weeks with DL Walker and talking about correct exercise and doing the right programs for exercise, so you don't mess up your alignment. But one of the things you can do is actually, instead of the eyes of the knee here, which is a very strong part, you could actually put it on the sides of your knee as well, on one side and the other. Now, my tendency is to put the tan on the outside and the white on the inside. The reason is because this area for me is weaker and this area is tighter. So the tan patch is more of a yin patch, so it helps to kind of more relax the area or make poofiness like less poofy, okay? And then this area needs more strength for me. So again, I'm using my acupuncture theory here, but this may or may not work for you. So just try it out. So I like to tend to use the white here and the tan here, and it helps my knee be a little stronger when I am doing exercise and things like that. Okay, so let's go back to the eyes and knee just for a moment. So I'm gonna put it back here. Now you've got your X39 on Hey Ding, right? So one other option is for the triangle protocol, you can actually put it on top of your kneecap. Now I do muscle testing, so I can actually just ask my body which points it wants, but for you guys that don't do muscle testing, it might be a little trickier. So you can just experiment. So again, 10 to 15 seconds, move it around, see if it's any better, okay? Now, earlier I said you could use X39 or AEON. Now the X39, I'm putting it near the knee, and if you have damage in the knee, that might be a good spot, to put it near the damage. Now, if you don't know if you have damage or not, and say you have a lot of stress and inflammation in your life, you could actually instead use an AEON patch, okay? It looks the same, I know, from this side, but AEON patch is the one for stress and inflammation, okay? My alternative to anti-inflammatory medications, okay? You could actually use that, instead here. And the benefit of that is that because it's an anti-inflammatory, you can actually have the anti-inflammatory right near, the area that may be inflamed for you, especially if it's hot, right? If it's hot, the Icewave is anti-inflammatory. This is an anti-inflammatory. We actually have thermographic data to prove that. you can see the inflammation go down. So, actually I think I messed up. Okay, that's the white patch. Okay, that's the white patch. Okay, so I've got Icewave here. In this case, I've got AEON here, and then you're like, well, but I want repair, right? What do I do with the X39? Well, put it anywhere else, somewhere else. So you can put it on the opposite knee, you can put it on the belly, you can put it on the back of the neck, which is part of the, in the X39 packaging, there's a point back in the neck. It doesn't really matter where you put the X39 because it treats the whole body. So your whole body, so stem cells will activate and go to wherever it needs. So you don't have to put it near the knee that's hurting you if you don't want to. So this is the fanciest protocol, or fancier protocol, or more advanced, where you have X39 for your overall general repair. You've got your AEON near the knee, either here or here, okay, on top of the patella. And then you've got your Icewave on the eyes of the knee. And again, you can play around with these, and see. You can even move these around in a circle, and to see what works best for you. And remember, you're just taking about 15 seconds, 10 to 15 seconds, yay or nay, doesn't work, isn't better, and then what you're doing is finding the best spot. So if you're 8 out of 10 and you get down to a 2, and that's as low as you go, you're good. So then you would take the sticker backings off, stick it on you, okay? Not using tape. The tape is only so you can move it around. Got it? Okay, so that's your triangle protocol for the knee. Now, some people say, well, Dr. Karen, I have 2 knees that are a problem. So how do I know which knee to patch? Do I patch both with the same protocol? Well, you could. Sometimes one knee wants certain patching and the other knee wants a different kind of patching. So you may have to play around with both. Now, here's the thing we've noticed over 15 years of, being a fan of these patches and using them, is that if you have 2 quote-unquote bad knees, all right, whichever one hurts worse, patch that one. Okay, if you're like, oh, I want to save money, I don't want to patch both knees, with all this fancy stuff, patch the worst one. Now, why do I say that? Because if the worst one gets out of pain, first of all, you'll prove to yourself it works, but second of all, the energy unblocked here, guess what? There's the same meridians on the other side. So oftentimes when you patch the worst knee, the other knee gets better anyway. Cool. Yeah. Here's some tips here. Okay, third tip. So say you're like, well, both knees are equally as, unhappy or whatever. You could theoretically, and I've tried this too and it has worked, you can just take your Icewave, white on right, tan on left, and just put it on both knees. Now, here it's right in the middle of the eyes, so it's right on the tendon, okay? That's right along the joint line. So you could do that, and I'll take this one away just for clarity. So you could do that. Just put white on right, tan on left. Again, you could put it right over the kneecap, white on right, tan on left. You could put it above, white on right, tan on left, okay? And you're like, oh, it got worse. Switch the colors. Okay, so that's like your third protocol we're talking about today. And that's just using one set of Icewave. So experiment, play, see what works for you. And I know some people, they're like, oh, well, it got a little better, but, I'd like more, more pain relief. Then another tip, cheat here. It's not really cheating, but what I often do is I'll patch whatever with Icewave. Then I'll take the AEON patch. Oops, no, that's X39, sorry. They look the same from the other side. Okay, so I'll take an AEON patch, okay, and I'll patch it behind the right ear. Now, you're like, well, that's far away from the knee. Why are you doing that? Well, this is a brain balancing point. Now, there are many. You can put it on the chest, you can put it on the back, but this is a brain balancing point. And what I found is sometimes when you're playing around with the Icewave, if you're not brain balanced, and that 15% of you guys, then you don't get as good results. But if you do put the AEON here, and you can play around with the Icewave, you're like, wow, I got, from a 9 to a 2, it's awesome, right? What you can always do just to test it out is you can actually remove the AEON, wait a few minutes in this case, because sometimes the energy keeps flowing for a few minutes, and then if your pain gets worse, then you're like, oh, I'm not brain balanced. Okay, so I'm gonna put it back here. Now, if you wanna sell the stuff, you can put it on your third eye, right? Walk around the grocery store, people are like, what's that? Do you have a sore up there? I'm like, oh no, it's a stress relief patch. And they're like, wow, I could use that, right? Where do I get that? I'm just kidding, I don't do it this way. But I had an 80-year-old one time, and just like she didn't get what I was talking about. So I thought she was going to use it at night, and she didn't hear that part, right? So she's walking around the grocery store, you know, the natural food store. And the natural food store clerk was like, I know who your doctor is, right? Okay, so that's our patching for today related to knee pain. Now,